Okay, so in this video, we're going to discuss the relevant anatomy of the hip in relation to what it is that's going on when you get pinching hip pain in the front with battements, fan kicks, squatting, lunging. So it's typically characterized as a pinching type pain in the front of the hip. So the hip is a ball and socket joint. So this is the ball part, okay, and the socket part is in here, all right? So there's a good amount of coverage between where the ball and socket meet, which means that the joint is pretty stable. So ball and socket joint, okay. The second thing we're going to speak about is a thin piece of tissue that goes around, so boom, boom, okay. So this is the labrum, and it wraps all the way around the head. It's outlined in green. This labrum, the tissue is similar to your ear or your nose. It's cartilage, so it's pretty soft and spongy. And basically it just provides stability to the joint itself, and it's like provides a little bit of a suction so that the hip and joint stay together. It wraps all the way around with the exception of a little piece on the bottom. All right. The second thing that I want to speak about in relationship to the joint is this tissue right here called the synovial membrane. That's just basically a big bag that surrounds the entire joint itself. And whoa, hey. This provides the fluid to the joint itself, so it maintains a nice slick joint surface. So fluid and stability. Next, we're going to add the capsule. So the articular capsule, again, it just provides a little bit of reinforcement to the joint to add stability. As you can see, it wraps all the way around. It's highlighted in green. And if you notice the direction of the fibers, they don't go straight across from the opposite surface. They kind of angle in to the femur, okay, and that kind of goes all the way around. We can see it starts on the back here, and then it ends up in here, okay. So that just provides additional stability to the joint. Is that express stability? Okay, we're going to add another layer, okay. These are the ligaments, all right? There's one and two that we can see right here. The ischiofemoral and pubofemoral. Again, as you can see, it kind of wraps around to the front. And essentially the ligaments provide stability to the joint by checking motion, right? And then the last layer right here, the iliofemoral ligament, so that overlaps the ischiofemoral ligament. And again, it kind of winds around at an angle, right? So the hip joint is pretty stable. Okay, it's very important that these ligaments maintain their normal tension. Ligaments are kind of like rubber bands. They stretch, and then when you release the tension, they go back to their normal resting position, where they should at least. So when we stretch, sometimes we're all, stretching out this capsule and or the ligaments themselves. All right, last of the layer, we're just going to add on the bursa. So the bursa are fluid-filled sacs, and basically they just protect tendons from coming into contact with the bone and rubbing. And so it just prevents the kind of, or preserves the integrity of the tendons. We're going to take those bursa away. And what we're going to do right now is talk about the muscles. Actually, let's step back real quick. So ligaments provide passive stability. Passive just means that they don't contract like I said, they're rubber bands. Rubber bands don't contract, they just stretch and then return to their resting position. So the other thing that we're going to speak about are the muscles. Okay, so the muscles provide the dynamic stability. There's two different types of muscles. Group 1 provides dynamic stability. Wait, perfect. Thank you, autocorrect. This is because they attach very close to the joint itself. So anytime that you go to move the hip joint, these muscles provide the stability to keep the joint secure so it's not flopping everywhere. All right. This muscle right here, the iliopsoas, it's actually a combination of two different muscles. This one highlighted, the psoas major, which attaches into your back, into your spine. Okay, you can't see it because it's deep. And then this muscle right here, the iliacus, and they form one common muscle group, the iliopsoas, and this attaches onto the inside of the hip. Oftentimes, if you bring your knee up to your chest and when you bring that foot back down to the floor, you get a popping pain or a popping sensation in the front of the hip. It might be due to this muscle belly right here snapping over either a bony prominence, a piece of bone down here. Okay, but this is not a pinchy pain in the front of the hip. We're going to get around to that in a little bit. All right, so we're just describing the musculature. And then we're going to add, all right, we're going to take a zoom out real quick. Okay, so we're just adding consecutive layers of muscles. As you can see, these muscles in the back, we added a couple more. All right, these muscles are responsible for, again, the group 1 dynamic stability of the hip joint. So think more like finer hip movements or just making sure that that hip stays in place when you go to lunge, squat, jump, run. Okay. And then the last group of muscles are the group 2, which are dynamic, which means moving mobility. So these are the actual muscles that move the leg. All right? You got your big glutes, your TFL on this side. So your TFL and your glute muscles attach to form your IT band, right, which kind of runs down the side of your leg. A lot of people often think that foam rolling relieves tension or it's myofascial relief. It's not. The IT band is exceptionally thick, and if you go to cut it open like in a cadaver with a very sharp knife, that knife blade will dull after a number of strokes, which if you're trying to foam roll, the foam roller is not going to do anything to that IT band. There's other reasons why it might help, but not that. So big muscles in the back, right? They provide the dynamic mobility. What we're going to do now is take away this muscle again, pop, pop, pop. Take away some of the connective tissue. And what we're not going to do right now is describe what's going on with this piece right here, the labrum. This is often the cause of that pinchy pain in the front of the hip if you bring your knee up and across your chest, or if you're doing a fan kick and you experience pain through the mid portion of that movement. So we're going to watch a short little video, well, two videos actually, on what possibly might be happening.
Femoroacetabular impingement occurs when the hip bones are abnormally shaped. As a result, the bones articulate in an abnormal manner, and this causes damage. The head of the femur and/or the acetabulum may form bone spurs. These growths cause the bones of the hip joint to grind against one another instead of gliding smoothly over the articular surface. With time, this friction can cause the labrum to tear and the articular cartilage to break down, resulting in pain and a decreased range of movement. This animation shows a particular type of femoroacetabular impingement referred to as pincher type. It is characterized by bone spurs that form on the rim of the acetabulum, which can lead the labrum to be crushed under the acetabular rim.
So that's one type of hip impingement, basically just an overgrowth of bone on this part of the joint. And when you go to kick or anything, this part of the bone comes into contact and you get that pinching pain. All right, the other type is a cam type, so this guy's going to discuss it.
Femoroacetabular impingement occurs when the hip bones are abnormally shaped. As a result, the bones articulate in an abnormal manner, and this causes damage. The head of the femur and/or the acetabulum may form bone spurs. These growths cause the bones of the hip joint to grind against one another instead of gliding smoothly over the articular surface. With time, this friction can cause the labrum to tear and the articular cartilage to break down, resulting in pain and a decreased range of movement. This animation shows a particular type of femoroacetabular impingement referred to as cam type. It is characterized by bony spurs that form on the femoral head. This prevents the head from moving smoothly within the acetabulum as the head is no longer round in shape. This can lead to friction and damage to the articular cartilage or labrum.
All right, so basically when you're bringing this knee up to the chest, this little structure is getting pinched in there. Now, note to self, this is probably the big takeaway about this entire anatomy lecture, is stretching into this pain does not improve the condition. Yes, if you stretch into the pain and you're getting this pinch here, like if you're doing just kind of laying with your legs straight and bending forward, and you're getting this pinching pain here in your hip, again, it'll be painful, and you might feel some relief from the pain afterwards, but you are in no way improving the tissue structure or anything else around it, as far as improving muscle coordination, balance, and strengthening. So if you do, or if you know someone that continues to stretch their hip out, to stretching into the pain to relieve this pinching pain in the front of the hip here, do them a huge favor and have them stop that. There's other things that we could do to improve the length of the capsule of the ligaments so that we can kind of free up movement at the hip so it's not restricted. Oftentimes, in my experience, what I've seen is a lack of mobility in the hip in specific directions, and basically it's often due to this ligament right here. So if this ligament doesn't have the appropriate extensibility, as well as the other ones in the front, when you go to bring that knee up to the chest, essentially what happens is you get a winding up back here and poor movement patterns which cause that pinching in the front. There's several different reasons for the pinching. One is a bony outgrowth. Another is just poor genetics. You just have not very good looking hips. And then the third one is something that you might have brought on by yourself, stretching aggressively into one direction and not kind of balancing it out with anything else. All right, I hope you guys enjoyed this lecture. Hey, knee. I hope it helps.